Main Talk. Let's talk about hair. It's not your average conversation. It's not your average conversation about hair. Good evening, everyone, and welcome to Main Talk Monday with your host, Deshaun Bullard. It's Monday, and so many things have happened this week in the world of hair. So as you guys remember, last week, I talked about me going to see Tessica Brown, the young lady who put the Gorilla Glue in her hair. And so I'm hoping that after we have this show, that you guys will kind of change your thought processes about what we do with beauty, what we do with hair, what we do with image, what we do with skincare. And so I am excited to bring on Dr. Hope Mitchell. So it's all about hair, guys. You guys always are coming in week after week after week, talking about what we need to do with your hair, wearing wigs and wearing braids and wearing extensions. But for us, it's a little bit more than just hair. It's skincare. As we heard from Tessica Brown, we all have what we call I call it HAI, hair anxiety issues. You know, Tessica simply wanted all of her strands to lay down. She ran out of her favorite product and she used Gorilla Glue. I know some of you guys may think like, why? But how many of us wear hair weave 365 days of the year? How many of us wear braids? How many of us wear braids, take the braids out, go into a weave, take the weave out, go back into braids, go into a quick weave? Tonight, we're going to spill all the tea as it relates to hair with Dr. Hope Mitchell. So we're going to bring her in to the conversation. Good evening, Dr. Mitchell.
Good evening. I'm so excited to be here.
No, thank you. I am fine. And thank you so much for joining the show. I was telling the viewers who are coming in, and they're coming in talking, that I was with Tessica Brown on yesterday. And one of the main reasons why we went to see her is we really wanted to do a scalp analysis. We wanted to look at her scalp. We wanted to see the condition that it was in. We wanted to find out if she was going to need to see a dermatologist, because that's how it works. But ironically, her scalp looked very, very, very good. There was nothing that we saw from my level of expertise with any scalp issues or anything like that. It seemed like that it was something that was temporary that happened. Her scalp was very sensitive, though, very sensitive to heat, very sensitive to cold. We did some oxygen scalp therapy treatments. We did one of our shampoos has camphor and tea tree oil. So it was she described it as her head felt like it was in a freezer. So versus it just tingling, a little cool, she described the extreme on each side, the heat as well as the cold. So I wanted to kind of dive in, because after looking at her scalp, thinking like, wow, and her scalp took a lot, right? So, you know, as a dermatologist working with skin, I'm sure you have all types of thought processes as it relates to putting something like Gorilla Glue on the scalp. So let me dive right in with some questions here, because our show is really only a 30-minute show, and I'm going to extend it just a little bit for you. Since we know that a lot of women experience hair loss, millions, according to study, millions of women experience hair loss. I don't know if this is a recent study, but I know it was about 30 million people suffer from hair thinning and hair loss, 70 million total, about 30 million women and 40 million men from an older study. But since so many people experience hair loss, I know a lot of women feel like when we do get to the point of hair loss, it's like, I just woke up today and my hair is gone, right? So my first question is, what is the first thing one should do when they notice that their hair is thinning or changing? What's the first thing a woman should do?
I think the first thing that women should do is just, acknowledge it. Don't deny it. Don't ignore it. Because time is follicles, right? And so if we waste time, we may be losing follicles in the meantime. Right. So I think it's critical that everyone seek a consultation with a board certified dermatologist. And the reason is that we want to make sure that there's nothing else going on, even underlying. There could be, we as dermatologists, through lots of different skin diseases, have found underlying problems, right?
Okay.
And so by coming in for an evaluation, we have found thyroid disease, we have found anemia, I have found lots of cases of a low vitamin D or vitamin
Mm-hmm.
D deficiency. And so it's really critical that you come in so that we can do a complete evaluation, partly like what you just did. We want to examine the scalp, right? We want to look for follicles. We want to look to see if there's any scarring. We want to consider a biopsy so that we can get a diagnosis. And so
Okay.
it tends to be a very comprehensive visit. We're taking a detailed history. We don't want anyone to come in with any confined hairstyle because we want to be able to look throughout the entire scalp. Even if you just think it's your edges, we want to look
Right.
all over it, because what we have found is that thinning edges can unmask a deeper problem.
Mm.
Underlying androgenetic alopecia,
Okay.
right? That
Right.
predisposition, and just catching it early. We have come so far in treatment options. And so we encourage everyone to come in, and we also encourage our patients or clients to be in partnership with their hairstylist,
Okay.
because we work together. We think of our domain as dermatologists as the scalp, and we think of the cosmetologist as the hair. And we
Right.
want to work in partnership when we're experiencing that problem called hair loss.
And I'm glad you said that because I always tell customers, I always joke and say we're both ologists, and
Mm-hmm,
I'm going to stay in my lane. I want my clients to go see a dermatologist to
mm-hmm,
do what they do as it relates to the skin, because I'm not trained, learned to do that. I'm trained and learned to do the hair part, right?
mm-hmm,
And so we can provide scalp therapy, but when it's out of that range, we have to prepare and educate ourselves as licensed cosmetologists to be able to refer back to a dermatologist, or even make the recommendation of going to see your general practitioner, because we know in today's time, a lot of women don't have insurance. And
mm-hmm,
so sometimes there are conditions, as you said, that have gone on for the whole year that they have not paid attention to, but they're focusing on the hair loss and not paying attention, like you said, to something that may be underlying by the time they get to you. And so let's talk about the dermatologist part. At what point, I know you said that a person, when they start losing their hair, they should immediately see a dermatologist. But is there a point that we move first to, and I'll just speak for me, clients will come in, and if their hair is shedding, we say, okay, let's go ahead and do a protein treatment. You may just need a protein treatment. The
mm-hmm.
cuticles may be lying wide open. We need to seal it. At what point, after we have done, let's say, maybe 3 or 4 protein treatments and it's still falling out, I think it's about, when people think about a doctor, they think about serious, like it has to be like almost at the breaking point before they see a doctor. At
Mm-hmm.
what point? Because in my thought process, there's a difference between hair thinning and hair loss. And unfortunately, a lot of women wait until it's at that late stage before they decide to see a dermatologist. So at what point do we move past the point of just trying to treat it in the salon? This is for the listeners, to go see a dermatologist.
So
And,
remember,
let me say something. And part two, a lot of dermatologists don't offer insurance. And so
mm-hmm,
I think sometimes the problem is money. So
mm-hmm.
let's talk about that.
And I think you're right. You threw that in there. You got me. The access part can be difficult. It can be challenging, right? And so there are a
Mhm.
lot of women who have built a bond with their hairstylist, a relationship, and the thought of taking their situation to someone they don't know,
Mhm.
especially if you're in a community where you don't have culturally competent dermatologists, right? Who understand me and my hair and my culture, right? Or if you've had an experience where you've gone to see one and they said there's nothing that can be done. We have all of that. I get it. We have all of that we have to work our way through. But I still want to encourage the viewers, the listeners, that we still want to seek a culturally competent board certified dermatologist. It doesn't mean that we want you to leave your stylist, because once you see us and we perhaps start treatment, we need the stylist to help us to style the hair so that you're able to get the treatments into the scalp that we may prescribe, right? That you're able to come in and have the treatments done so that we can see where we're going. So
Mm-hmm.
I can't stress enough the importance of the partnership. And let's put it this way: if you come to see the dermatologist and nothing is going on, hey, I love giving good news.
Right.
Don't you love receiving good news?
Yes, yes. But
I
I
would
love the
love
word
to
that
hear
you use,
everything's okay.
culturally competent. I love that. I'm gonna steal that from you
Mm-hmm,
because there's so many customers that I just spoke with a client last week who said the exact same thing. She went
mm-hmm,
to a dermatologist who was not culturally competent.
mm-hmm,
They told her that they really didn't understand her hair. She said she had dime sized patches in her hair. She had gone through injections, steroids. It wasn't PRP. They did the steroid injections. And she felt like she did, I guess, however many treatments with that. She didn't see anything. And she just felt like there was no energy, no no concern,
mm-hmm,
no help, no anything. And so I asked her about the cultural standpoint of what she was seeing, and she said I mean, point blank, they just said they didn't know about my hair. So I love that word about being culturally competent. I
mm-hmm,
think that's a lot of people who are in groups such as medical groups, whether it be PPO or HMO, sometimes they feel like they are, they're stuck like at this point and
mm-hmm.
have to go see a dermatologist in the group. And so I find out a lot of people have issues when it comes to being inside of a group as it relates to their insurance.
Can I put out a plug? Since coming through the pandemic, there are a lot of Black dermatologists, let's just put it out there, that do virtual visits. And I would encourage the listeners to seek out at least a virtual consultation, because you may find just by talking to that dermatologist that, oh, I know so and so is over there, and you may not mind taking a 2 hour drive. It may be a good thing to do just to get the treatment. So I always say consider that. And then one of my dermatologist colleagues came up with or developed a platform called Black Derm Directory. And
Okay.
blackdermdirectory.com is a platform where you can put in your zip code and you can find a Black dermatologist.
Okay.
And so
So
we're always saying that blackdermdirectory.com. And she did that for this very reason. It was to help our community to be able to find a culturally competent dermatologist, right? And we're talking hair loss today, but for some of us, it's eczema, right? It's dealing with conditions that affect us very differently, conditions that we carry a burden, but we also, at the same time, we have difficulty finding the proper treatment for some reason.
right. Right. Well, I'm glad that you gave us this. It's ticking at the bottom, you guys, and I see some comments coming in. We'll get to your comments. Please ask your comments tonight. That's why I have Dr. Mitchell here, because we want to really talk about all the myths and dispel all the myths as it relates to hair loss, hair thinning, hair products, so forth and so on. So let's go to the next question,
Okay.
Dr. Mitchell. Is it normal at a certain age to start losing hair? And if so, what are some things that can be done to delay the process? And I say this only because we know at a certain age, I hear so many women say the same thing. It's kind of like me with the glasses. One day I was looking at TV fine without any glasses. And one day, I swear, we just talked about before, we're like in the same age group. One day I woke up and the TV was blurry and I kept squinting my eyes like maybe I had
Right.
like, but my eyes had changed. And so I think
Overnight.
people overnight, it's like overnight. So the same thing I notice with women who are aging.
Mm-hmm.
A lot of women, as they get older, our hair can begin to thin out. But is there something that we could do, as we do with the skin, as you say, to prevent wrinkles, and we have hyaluronic acid, and we have collagen, and we're talking. Listen, I'm that age, so I'm looking at all those type of things. But what can we do if if losing hair is part of the normal process, and if it is part of it, is there something that can be done?
So that's a really, 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 really favorite question of mine when I'm asked that. Because one thing we do know is that as we mature, our hair is going to thin. The other thing that we do know is that hair loss is multifactorial. So it's never just one thing, right? So hold that thought. Mm-hmm. And then the third thing is that we can start losing hair at any age. So it's not, just as we're aging, but we can lose hair at any time. And, just going through the pandemic, for example, all of that stress, I think everyone could say that people of all different ages were losing hair. So imagine putting that on top of aging, putting that on top of postmenopausal, right? Perhaps putting that on top of a nutrient deficiency or poor diet, right? So we have stress, we have maybe genetics. I didn't even say that. Mm-hmm, maybe we have a genetic predisposition. You know what I'm saying? So we've got postmenopause, right? Where we are thinning, aging, genetics. Then maybe we have a metabolic issue. Maybe we have a thyroid issue, a low vitamin D. I just named about 4 or 5 things.
You did, but what about I have to throw this in because we have a lot of women that have like hysterectomies. What about that? Premenopausal.
Yes.
I have I had to get a hysterectomy, and so now my whole body's just thrown off.
And that's why it's important, as soon as you experience hair loss, no matter your age, that you get checked out by a culturally competent dermatologist.
Okay.
Because I guarantee you that dermatologist is going to spend more time with you in your hair evaluation, first of all, right? Okay. Because they're thinking like you, right? They understand you. They're going to be more compassionate towards you, looking at you, and you have similar hair, right? We understand that. We're going to take more time, even if there's not much going on, to explain to you, these are the things that you want to be aware of. These are the things that you want to look out for. You want to make sure every year you're getting your blood work. Every year you ask the doctor to check your vitamin D. You don't miss your physicals. If you start to thin, ask your family questions. Is there genetic hair loss in my family? Mom, what's going on with you? A lot of times we didn't know because no one talked about it. So you want to ask those questions. You really do. So to answer the final part of the question, things that you can do is definitely try to keep your stress under control. And by stress, I don't just mean the emotional side of it, because I get it. We're all going through things, and some of these things hurt. Let's just be real.
Yeah.
But there's physical stress to the body. For example, uncontrolled diabetes, uncontrolled blood pressure. That causes the body to be stressed and to produce inflammation, right? And that inflammation in the blood system can go everywhere and wreak havoc, right? It can cause our arthritis to flare. It can cause our hair to shed. And so, we're talking about finding medical problems, keeping them under control, limiting inflammation, eating the proper foods, the antioxidants that can really, really attack that inflammation so that you can keep a healthy scalp and grow the healthy hair that we all deserve.
I mean, you've said a lot, and I think that people don't really realize that. Of course, I have a brand, Neurotress, and we always, promote healthy hair from inside, with the vitamins and all of that. And I really only started it because of my own journey. Out of all the things that you said here, I was the premenopausal girl. At 21, was diagnosed with premature ovarian failure due to my thyroid that created antibodies and all this other stuff that happened to me along the way. And when I went to beauty school after graduating from college and wanting to still fulfill this passion of hair, they used me as an example of what your hair should not look like in class. And I wasn't even doing anything, but lo and behold, it was my thyroid condition. And then after working with dermatologists and, working, so that's how the passion grew. It stemmed from me being, being a person who was going through all of these things and nobody could tell me what it was. Nobody ever said anything to me about a dermatologist. It was my primary physician who finally, after going through, because I was trying to have kids and all of that, going through fertility treatments and all of that. And it took one doctor who talked to me about everything that I was going through and about maybe seeing a dermatologist. So you said a lot. I think in our community, a lot of people wonder, you okay?
I think so.
Okay. Mm-hmm. Go ahead and let you take a break. You guys go ahead and put your comments in here. Thank you guys. I see what you guys are talking about. It is a lot of good information. Yes, yes. Black Derm. Thank you, Sharon. Black Derm Directory. Thank you, Allison. BlackDermDirectory.com. It is a lot of information, and we will, Karen, get to the DHT inhibitors. I see your questions here. I see it. But one of the things that I want to talk about, as I was just saying, a lot of people never really related back to health. And a lot of us have health issues. And the first thing we want to do, and I'm not going to blame it on the customer. A lot of times it's us as a hairstylist just not knowing what to do. Mm-hmm. That's why NeuroTrust has tried to be as instrumental as we can by teaching the basics on at least knowing how to do a basic consultation. Because mm-hmm. as you said earlier, we are sometimes the first people that see what's going on.
You're the frontliners.
We're the frontliners, but we are also the first people who overlook it, because we think that we're going to get blamed for what's going on because we don't know. And so what I've heard from a lot of stylists is that, I've been doing her hair for years. All of a sudden it's thinning and now it's my fault. So I don't want to say anything because I may think that, or she may think that it's my fault, instead of just addressing the issue. Me as a licensed cosmetologist myself, when I would see my clients' hair thinning, one of my friends is on here now, I'd be like, hey, something is going on. And if I think it's something that I did, such as when we were silk pressing with the relaxer before natural hair, it's like, it seems like your hair is thinning. I think we need to stop this technique. We don't have the confidence, some of us licensed cosmetologists, to really dive in and have that question. So our first defense is to put weaves in, quick weaves, braids, and things like that. So my next question is, how does styling techniques like braids, weaves, and all of these extra hair styles that we wear, how do they play a role in hair loss?
Okay, so, my response to that is that we as a community of Black women are very creative, right? That's part of our culture, to switch up our hairstyles. And you and I, we both love it. So we're not here to knock the styles if they're done appropriately.
Correct.
Right? We love it.
Correct.
But when they're not done appropriately, again, that can wreak havoc on our hair. So some of the things are going to be the obvious, wearing the styles too tight, right? Pulling on the edges, not allowing the hair to have breaks, right? Putting tight braids and weaves on top of a perm, those types of things. Perming your hair at home, and then going into the stylist and not saying what you're doing, and then getting this style. And, there are a whole lot of things that can contribute.
Right.
The locks, when we're getting our locks retwisted, they're too tight.
They're too tight. And we're putting the metal clips at the scalp. The metal clips under the dryer, and this heat is burning.
Yes. Now they look beautiful, but they're too tight. When you start to see your scalp raising up over the braids, and you start to see the hair bumps along the edges, right? Those bumps that are in the follicles, it's too much.
Yeah.
It's too much. And so my recommendation, or dermatologist recommendation, is if you're going to do them, don't leave them in too long. And every style is going to be different. Give your hair breaks, right? And just don't do it too tight. Those are kind of the basics. And so what we find, what we see a lot of in the dermatology practice that drives people in would be either they're losing their edges, or they had a weave that was pulled out and it pulled out their hair.
Right.
Or it was finally, like you said, brought to their attention that they have a big patch of hair loss, that something really is advancing. So that those tend to be the scenarios that I see in practice.
Before we move on with the next question, I was thinking about what you said, and it brought me back to a conversation that I was having in the salon with a client who said that she had worn like quick weaves for maybe like 3 years,
Mm-hmm.
and that in the salon, she never got a chance to see her hair. The stylist will take the weave out, shampoo her hair, bring her back, put it in. She never paid any attention to her hair in the mirror. That wasn't what she saw. And she said one day the stylist just happened to leave the room and she went to the mirror and she didn't have any hair. And she said at that point, she was like frozen in time. How important is it? And I'm so glad that you're here. How important is it for us? And I know that there's a lot of Black derms, in your community who are reaching out to hairstylists. But a lot of hairstylists also feel that the dermatologists don't want to work with them or look down at them or, belittle them. How important is it for the Black hairstylists, more importantly, to really come to? I just joined CARF.
Yay!
Yeah, I just joined and I shared the link in my hair loss group with other stylists because I just want to be, as a brand owner who is, focusing on healthy hair, more importantly, and helping my customers not go down that road or, returning the hair back to a full restoration before it's too late. I felt like it was important for me to join the organization just to get as much information I can from you guys, listen to you guys, just so that I could transfer the information, connect with the Black Derm directory, which I'm going to put it back down here at the ticker here to find out how we can start recommending customers to dermatologists across the country. But I know this wasn't a question on your list, but how important is it for us as licensed cosmetologists? Because I do feel, and I'm conscious about this myself, that a lot of licensed cosmetologists, and some of them are watching, they want to be doctors, but we're not. And you can't diagnose, you don't know, it's certain things you just can't do. So how important is it for us to get some type of information? Where can we get it from? Should we join CARF? I think CARF is a little above for some people, but where are some of the basics we can start from as it relates to partnering with the dermatologist?
I think the place to start is in our minds. We have to renew our minds to the point that it is not about us. We have to do what's best for our patients, for our clients, and we cannot be successful without each other. It's just that simple. The education that our patients need when they're experiencing hair loss, it cannot be successful without the two of us, right? Mm-hmm. You have much more training in hair care than I ever have had. I have some only because I'm culturally competent.
Right.
I take care of my hair. I understand. Right. But that's your jurisdiction. And the scalp is my jurisdiction. I always tell patients that come in and they start to ask me, well, what shampoo and what conditioner and what this? And I'll say, okay, the only reason I can somewhat answer that question is because, remember, I have hair like yours. Mm-hmm. Mm-hmm. I have been through a lot of products, but it's your cosmetologist that's going to know what products are best for your hair. But we can start here. We can start at this point. The scalp is my jurisdiction, and I'm responsible for understanding how to get your hair to grow out of your scalp.
Right. That's
right. And so that means we have to work together for patients to be happy, right? To get the results that they're looking for. So we have to stop thinking that we don't need them and they don't need us. And if we have to, it's a mutual thing. Get out into the community. I have to get out. You have to get out, and we have to meet each other. We have to say, here's my card. Can I have your card? I see that you work with natural hair. I have patients that may need services. If you have concerns, I would love to work with you, et cetera, et cetera. I can't be successful without my patients understanding how to take care of their hair. And it doesn't make sense to grow their hair and it's just breaking off, because you and I both know that's the main reason. It's retention. If we can't retain the hair that we're growing, we're wasting time.
Exactly. But where you are, just even talking with you, this is my first time talking with you. Just your spirit, you have a approachable spirit. And some of the feedback that we've heard from a lot of stylists, because, they ask me when I teach classes like, what should we do? They're so nervous to talk to a dermatologist. And I think because they feel that they're not confident enough to talk. I'm a little different. I have a degree from Tuskegee University. I was in IT. I kind of came into the industry a little different. So, I worked in corporate America. So my background is different. So I may feel okay to reach out and talk, or I may know how to address a dermatologist who may talk to me some kind of way, because I've had it happen from a Black male dermatologist who talked down and was using words like comma. And I was like, well, I'm offended by the conversation. You don't have to say comma. Let's have a conversation. So I think, I love the conversation about bridging the gap, and I just don't know how we can do that. We have the hair show. I think Black Derm should come to the hair show, and I think the cosmetologist should come to something, not a derm show, but something.
There is a good one on the East Coast. Maybe we can connect afterwards. That is done. I don't know if you know Susan Peterkin.
No, I don't.
On the East Coast. So there are some, but that's an excellent way that we can partner and learn from each other.
Right.
Because we do get a little bit nervous about talking about how to style the hair.
Okay.
You know what I mean? Because we didn't learn that in school.
Right.
And so for me, that's why I always preface it with, I only know a little bit because I have similar hair to you.
Right.
Let's find out who your cosmetologist can be so that as we go through your journey, you can have the greatest success.
Okay. I see you guys' comments, guys. I'm coming to them. I see them. I see them lighting up, but I want to get through these next questions right quick, and then I'm going to come. So don't go anywhere. So most people, when they go to the dermatologist and they're diagnosed with alopecia, I experience this a lot in our clinic. And I hear some people in here like, yeah, this is what we do at our clinic. They come in, and when they hear the word alopecia, it's like a death sentence. It's kind of like, I'm about to die. My hair would never grow back. When we know the definition of alopecia simply means hair is not in an area where it normally grows. And it doesn't mean that it's permanent, because it could be telogen effluvium. It could be temporary after you had a baby. It could be temporary due to stress. It doesn't mean that it won't grow back. So if someone is diagnosed with alopecia, what should the next steps of restoration be, if it's possible, upon the diagnosis?
So this is a great time, as you probably know as well, for hair loss, because I've been in the field for 23 years, and I've never experienced a time where we've had so many options for regrowing the hair.
Okay.
That's the first thing that I want the listeners to understand, is that we're in a good time and we keep getting new treatments.
Okay.
Now, some of the treatments are cosmetic and you have to pay out of pocket, but many of them are not. And again, I know I sound like a broken record. That's why it's so important to seek help. The first question you asked, as soon as you see the thinning, because the sooner that we treat it, the sooner that we intercept, the sooner that we can educate you, the less likely we're going to get to a point where we need to have hair transplantation, or we need to say transplant.
Right.
So we have all kinds of medical prescribed, approved treatments for hair loss. We just need to catch it before those follicles scar. Once those follicles scar, we can't bring them back.
Yeah.
And so that's why I'm so glad you asked me to come on. I am passionate about this, about trying to get the word out about hair loss. I can't tell you how many direct messages I get about hair loss where people, in my opinion, I was just talking to a colleague, have just been miseducated, misinformed, dismissed, and it's really sad.
It is. It's very sad, and unfortunately, we wait too late. And again, like you said, the stylists are the front line, and I'm gonna love to connect with you afterwards, just to really. I'm so passionate about making sure the stylists understand, and that is not just about money. Sometimes in our industry, as stylists, it can be about, oh, I want to jump into this hair loss because I can make more money. And I tell people that call me, that ask the question, I say, if you don't have the passion, or if it's not going to be your ministry, then I advise you to don't do it. Because it's more, it takes a lot out of you. from a standpoint of people crying and people
That's
pouring out
right.
their hearts, and it's
I was
not
just going to
like,
say that the emotional side of it.
I have one of my team members on looking now, and sometimes we would have this running joke, Dr. Hope. We would walk out, and if we hold our hands like this, that means sometimes we just want to cut our wrists. That was like the little thing, because sometimes it would, Dr. Mitchell, it would, it's emotional, and sometimes it could be so emotional to some of my team members that they just give the service away. It's like you're there, and we're emotional people, and we have a heart, and at the end it's just that, okay, we're just going to do all of this for free because it's emotional. And I have to tell them, so we're in business, and so we have to, I think about when I went through fertility treatments, I thought that my doctor was the worst. He had no bedside manners. But I understood later on, with all of these women coming into him having the same problem, he had to have a little bit of disconnect. He didn't have to be as disconnected as he was, but he
Right.
had to not have so much emotion drawn into it, because it's a lot. So I always tell stylists that we really, really, really need to make sure that we're passionate about helping women, and we're passionate about results, because that's what drives me, as it relates to products, as it relates to being in the lab, as it relates to working, as it relates to stalking guys like you on, social media, or partnering with doctors like I have with Dr. Nikki, or as I have with Dr. Lindsay, bringing them on to the Bronner Brothers show, sitting on panels with me, just trying to get the information out, because we need to work with each other. Okay, I'm going to go on. I'm going to get some comments after this question, guys. Okay, let me ask this. I just want to get through my questions. So everybody's going vegan. Everybody's, trying to eat healthy. We're trying to lose weight. We're trying to stay fly, right? You want to stay,
That's right.
young, at least young looking.
Right.
Exactly. And so how does nutrition play a role in hair thinning or hair loss, especially with vegan, or I remember trying to be a pescatarian when I turned 50. I said I was going to be a pescatarian for the whole year. Well, it only lasted for about 4 months because I was getting sick. It just wasn't working. So I added some chicken, back into the mist. But I have a niece who is vegan, and we talk often. And so let's talk about that. How does nutrition play a role in hair thinning and hair loss?
So I think of that as two directions, in terms of, like you said, a lot of us have gained weight in the last year, and we're trying to lose weight. And so, as you know, we want our audience to know that losing a lot of weight too fast, right? It's kind of called crash dieting in the literature, but losing that puts stress on the body. The body has never seen that, and that can cause hair loss. I've seen that quite frequently. Where people say, "Well, I only lost 20 pounds in the month, in 1 month," and your body may say that was too much, too fast for me. And this is the response: the hair shedding and thinning.
Okay.
Like you said, switching up that diet and going vegan, and maybe starting to miss out on protein, which provides the building blocks for hair. So not getting adequate protein in the diet, as you make that switch. And so it's really critical to balance the diet with fruits and vegetables, and making sure that you get plenty of vitamin C and vitamin D, in your diet. I always tell people when they come in, I'll say, rather than me telling you what to eat, because that's not what this is about, just Google foods rich in proteins, foods rich in antioxidants, print off the list, highlight the ones that you like, and buy those. Because we both know we're only going to be consistent or successful when we're doing and eating things that we enjoy.
Correct.
So let's not set people up for these traps, right? And send them on their way and say, this is what you need to do. And let's also make people accountable.
Right.
Do the research, do your homework, figure out what you like, and you're going to be more successful. So I often tell people to do that, so that they start to weed out the foods that they know are just filler foods that are doing absolutely nothing to stimulate the hair to grow. And a lot of these foods, it's going to be a bonus, right? Because if they're going to help your hair, they're going to help your skin.
Exactly. Yeah, we want our skin. Listen, we want our skin to look good.
That's right. So, yes. So all of that is going to be like a bonus, So I think it's really important to pay attention to your nutrition.
Okay, well, good. Well, speaking of skin, we have a question here. Let me bring this question up. Speaking of skin, we had Sharon says, how can we slow down hair growth in unwanted areas, face, chin, etc.?
So the hair growth in unwanted areas is a condition that we call hirsutism, which is hair growth in a distribution that we think of as a male distribution, right? The neck sometimes, the chin, the mustache. Sometimes we even get it between the chest. And normally that's a hormone imbalance. And normally we can start to see it as we go through menopause because our hormones are shifting. But I also should see it in young people who just have maybe irregular cycles. Okay. And so, of course, if you're postmenopausal, you're not going to be put on birth control pills, etc. But there are oral medications that we can prescribe. One is called spironolactone, so that might be an option. But I also think that products like your vitamins,
okay, Dr. Hope,
saw palmetto in it, right?
Yes,
that has saw palmetto in it, can help to limit the testosterone level.
Yes.
Help to balance your hormones and help to limit, right, the testosterone that we think is acting in a dominant fashion. Okay. So a lot of times I explain that to women in that taking supplements that have saw palmetto in it can help to balance your hormones. And then last but not least, some patients will have laser hair removal, if appropriate.
Okay. So speaking of saw palmetto, and somebody asked a question about explain a little bit more about the DHT inhibitors. Can you briefly just go over like with DHT inhibitors? I know I've talked about on the show a lot, but we have the real professional here now just to talk about, as we talk about saw palmetto and DHT blockers and things like that. How important are DHT blockers, DHT inhibitors as we talk about, hair loss and hair restoration?
Well, definitely, we know that can actually trigger, just to not go into great detail, the receptor activity that thins out the hair, right? So binding there and causing the hair to thin or fall out. And so we know that the saw palmetto can inhibit that. And so that's why we highly recommend that. Some people take it, isolated. And most people, I say it's better to just blend it into a vitamin that has so many other things in it, like your vitamin, for example, that has other active ingredients to help stimulate hair growth, the silica, the zinc, etc., all in combination. So
yeah, we worked hard. We've changed our formula 3 times over the past 22 years. And every time I get more information, like adding D3 and cayenne pepper and the horseradish extract, those were the last things that we added, a few years back, because just getting more information and wanting to provide something that is not so expensive, because again, we talked about reach and access that can inhibit us from, wanting to move into using something that can help us. We have Sharon,
a great formulation.
Thank you very much. Sharon has another question. She says, how are follicles scarred and what are the causes?
So follicles are scarred. We're gonna keep hitting this. Follicles become scarred when we ignore hair thinning and hair loss. Right? So the progression is that the continuation of the hair loss, eventually that follicle will scar. Right? And so we're born with all the follicles we'll ever have. That's why I always say time is follicles. It's not like we can make a new follicle. The best we're going to be able to do if you have scarring when you come into our office is to see if we could stimulate hairs to grow out of those follicles that are left. Can we get more hairs to come out and fill in the density of this scarred area? Because we're not going to get new holes to produce hairs to come out of. So the scarring comes from that continued trauma to the scalp. The continued trauma, the continued inflammation will cause that follicle to just eventually shut down. And then it's done. Once it shuts down, it's done. And so an example would be that continuation of the tight braiding or the weaves, knowing that I'm losing my hair, but I continue to cover it up instead of seeking treatment or addressing it. And so once it scars, it just means there's a smooth surface. There are no holes to which hairs can grow out of. So causes are going to be, again, continued inflammation and trauma to the scalp, pulling, and not correcting the problem.
That's great information. Thank you. My last question of the night, and people have been waiting on this question because we are all asked about, or we're all talking about today in the world about getting the vaccination. And so many people have so many thought processes about the vaccination. We know that medications can wreak havoc, on the hair as well, depending on the type of medications you may take. And people have issues with taking medications and like, oh, my hair is thinning and this and that. So let me ask this last question. Will getting the COVID-19 vaccination have an effect on our hair? I mean, inquiring minds want to know. People have asked, like, is it going to affect my hair? And it's crazy that we would think that, but I guess they think about all the other things that go in our body, as we talked about: food, diet, other medications, high blood pressure, diabetes, thyroid. And here now I have all of this. And now I'm going to get the COVID vaccine. Is it going to have a problem on our hair?
We don't know yet. I hate to end the show this way, because I feel like it's a downer. But we don't have enough evidence, you know what I mean? We know that we were in the studies, that, we were there as a community, Blacks, but we don't even know that was really a side effect that was really monitored, hair loss.
Right.
We have not seen that in terms of an AE or adverse event. Right. So, we know that there are some adverse events, but hair loss itself, we just don't know. I would have to say, I believe the answer will likely be no.
Okay.
Because the flu vaccine is a no. Right.
Okay.
But I still encourage my patients to all the antioxidants that they can do, you know what I mean? All the fruits, and just keep the body healthy. Keep your antioxidants going. Your water, your fruits, your vegetables. Just keep the body happy.
Well, listen,
we don't know the answer for sure.
Oh my God. Oh my God. I don't know. Crazy. I don't even know which way my hair is. Okay. All right. So, ladies and gentlemen, Tyrone, I see you here. Yeah. Yes, ma'am. I love this. He said it is much needed. This conversation is much needed, but Allison is on here and she's just blinging it up.
Hey, so Allison, I think she sent me the email.
Yeah, she did. So she said, ask Dr. Hope, how can I get my hair to grow out of my scalp faster? I know this is funny. Most people, I think we live in a time where we want everything fast. We can type in information on the internet and we get it. Dr. Hope Sharon, you have Dr. Holly, Dr. Hope Mitchell, that we get our information quickly. We get it fast. And so we want everything fast. We want our hair to grow back. And I'm sure that you get that from patients all the time. They come in, they've been wearing weave for literally, I know in our clinic, when we make them fill out the evaluation, you have some people saying they've been wearing weave for 7 years and 10 years and 13 years. And, then we have it as little as, 3 years. And to me, that's a long time to just consistent with no breaks in between. So we want things fast. So getting back to Allison's question, how fast, how can she get her hair to grow out of her scalp faster?
I think that's a good question, because a lot of people ask it, right? And so you and I know that the hair grows. I think where the disconnect is the retention, right? I think that's the issue, is that the retention, we're not retaining length. So I like to think of it as the hair grows about 1/2 inch a month, right? We know that it grows. But if we're going to keep it growing, we have to keep those ends healthy. We have to keep the hair healthy. So are we experiencing breakage? I think that would be the question. Is the hair dry? Is the hair healthy? Is it breaking? What's happening that she's not perceiving the hair to be growing? Because we know it's coming out of the scalp, right? It's coming out. So the length, I would say, I would question Allison to think about, why am I not retaining? Am I getting haircuts very frequently? You know, am I taking the length down because I just like it down? Am I getting those basic trims? You know, am I retaining? Am I putting water on? Am I keeping it hydrated? You know, is my hair happy? So I like to turn it into thinking about it that way.
That's good, Dr. Hope. You know, I know, of course, I know Allison, and Allison, she likes to get her hair done maybe 3, 4 times a week. And
Oh.
sometimes it could be, I tell it could be a little bit too much, you know, just heat, 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 heat
Oh,
on
see,
Saturday,
you're adding.
you know, heat on Wednesday, heat on Friday, you know, the whole shampoo. But, and I'm going to ask this question on your behalf, Allison, because you didn't ask this. Allison has seborrheic dermatitis. And so that is another reason why she wants to keep it, you know, shampooed so much. And she has a, I
That
can't
could be
remember.
making it worse.
Yeah.
That could be drying the scalp out.
Okay, Allison, you hear
So
that?
we don't recommend frequent shampooing with seborrheic dermatitis. As you and I know, that is a medical condition that needs
Yes.
medical treatment.
Yes.
And so we normally recommend that the scalp be shampooed no more than once a week. So once a week, definitely. The other thing that she can do is use the medicated shampoo. Just make sure, and I'm sure you've told her that, make sure she's just using it on the scalp,
Yeah,
right? The medicated shampoo.
She has a prescription that when she comes to the salon, that we use a prescription on her scalp. And not me, one of, you know, her stylist, Tyrone, who's on here as well. He uses it on her scalp, but she uses it, you know, she likes to get her hair shampooed literally like 3 times a week. And so that could be making it worse.
That could be making it drier.
Drier.
Yes.
Okay.
And another thing that she can do too with her, because the scalp naturally makes sebum. And so we recommend just take the balls of the fingers and just really massage the scalp, because a lot of times there's oil right in the scalp that she can massage through the scalp. Definitely don't put oils on the scalp. I'm sure she knows that, because that just feeds the yeast that's causing the problem.
I'm so glad.
Do that. And sometimes people do that. They put oil, and that's why they feel like they need to shampoo more, because they eventually feel that buildup.
Yes.
And so it's like a vicious cycle.
Yes.
So I would encourage her to work through those steps backwards and just think about once a week. Really massaging the scalp. She doesn't need to put oil there. Use the medicated treatment to the scalp. And she should be able to come out of that where she will get comfortable. She's not going to do it tomorrow. She's not going to go from 3 times a week to once. That's not what I'm suggesting.
Right.
But maybe Tyrone can take her to twice and then eventually get her to once a week.
I know what Tyrone added in. If you haven't had a history of long hair and the hair is only going to do what it's going to do, sorry, but just speaking the truth, what he's saying is that, you know, a lot of people want long hair, and if you have a if you don't have a history of long hair in your family, genetics, your hair is just not going to grow. We're Dr. Hope Mitchell. Thank you so much. People are saying, Janie said, great information, ladies. Etna saying, you know, great information. Alicia saying, you're the best. Sharon said, what is CARF? What is the cicatricial
alopecia
Research Foundation?
Research Foundation.
And so that's what that is. And so thank you all. Make sure you still comment on. I don't even
want to go.
I know we'll have the comments are still coming in. Okay. We're gonna have to just come back. Now that you're here and we're sisters, right? We'll just have to come back, because I really have a passion for making sure that the people get the information. And so that's what Main Talk. You're welcome, Alicia. Alicia saying thank you. That's what Main Talk is all about. That's what we call a Main Talk. We talk about how hair affects our everyday lives, whether we're talking about the election and we're stressed out, whether we're talking about our previous first lady, or not the last one, the one before that, Michelle Obama, how everything we do in our daily lives. And now we're talking about Tessica, brown with the, Gorilla Glue, because we do have a fetish about our hair, but we're not really talking about it a lot. So please, please come back and let's talk on the show. Thank you, Etna. She said really, really enjoyed the conversation. So we'll have to have you back. I'll send you a link, because as they ask questions, guys, you guys will just keep putting questions in the comment. The show is only 30 minutes, guys. So we are almost at an hour tonight. So we stretched it. We stretched it because I knew this was going to be great conversation. So thank you, Dr. Hope Mitchell.
Thank you for
joining us. And we would definitely have you back. Guys, again, put your comments at the bottom.
Can we stay in touch? You promise?
Yes, I know. I promise. Allison, if you're still listening, if you're not listening, we'll make it happen. We'll stay in touch. Thank you, guys. You guys have a great week. Join us next week. We're going to have another great conversation, but I'm going to save the topic. I'm not going to tell you guys about it now. I'll let it be a surprise for next Monday. You guys have a great evening and stay safe. Bye-bye.
Main Talk. Let's talk about hair. It's not your average conversation. It's not your average conversation about hair.